liability to the supervising physician.
Well, let me play devil's advocate for a quick second. If the nurse is in consultation with the doctor makes a recommendation, the nurse doesn't necessarily follow through with it, and so they're not on the same page.
Right.
How does a doctor protect themselves from that?
Yeah, it's on a case-by-case basis. Obviously, what a doctor has to do in a tort context, when there's an allegation of medical malpractice, you have to demonstrate that the doctor did not act within the scope of care, did not act in a reasonable way. And so you have a situation where a physician, provided clear guidance and instructions, and the nurse practitioner failed to follow them. That would be, my understanding of the law, that would insulate the doctor from vicarious liability, because the doctor would have exercised reasonable care. But really, it's fact dependent. It would depend upon the facts of the case. Whether or not the doctor was in regular contact with the nurse practitioner, whether clear instructions were given. I mean, those would all be fact-dependent issues. But your point is well taken. I think that doctors and medical physicians can still insulate themselves from liability for adopting best practices in regard to working with nurse practitioners.
Well, another thing, I know we're going to take a break in a couple of minutes, but before, I just want to frame the next question about training. I understand that there's been a difference in the education of the nursing profession over the last several years, but it's not quite the same type of training that a physician gets.
Oh, no doubt.
Right,
I mean, there's always going to be a disparity in the level of expertise, and I would be the first to concede that physicians and medical doctors have much more training and have a much broader range of abilities than nurse practitioners do. There's no question about that.
Well, can you clarify what is the scope of practice for a nurse? What are the things that have been expanded under the new law that they're now able to do? Because I'm still a little fuzzy on that.
Sure. The law itself goes ahead and defines the range of things that they're allowed to do, and I'll just go ahead and read from that if that's helpful. If I could just list the things that nurse practitioners are permitted to do, independent of there being a practice agreement. But the main thing is that, if they want to practice medicine, or if they want to go ahead and provide healthcare services, they basically have to be tied back to that written practice agreement. Now, there are certain non-medical things that nurse practitioners are allowed to do, such as certifying or recommending somebody for physical therapy, and there's a definitional section in the bill itself that defines, what are the things, if you get an advanced nurse practitioning degree, what are the things that you are trained to do, and it lists those particular things.
Like refer people for hospice and for physical therapy. Yeah, those are things that I've read in the law itself.
Right, and again, I mean, I think really the thing that's most important about this agreement is this bill, is it gives flexibility to the medical doctor or the physician and the nurse practitioner to, in a written agreement, specifically define the scope of things that nurse practitioners can do under the auspices of that supervising physician. And it's like in my law practice, I have a paralegal who I've worked with for 33 years. She probably knows more about real estate than I do, and I have a great degree of comfort in regard to how she handles things if clients come in, even if it is under my direct supervision. By contrast, if there's somebody that's coming right out of school, or they have a paralegal degree but they don't have any practical experience, I'm going to be very wary and very hands-on in regard to what that paralegal can do. So what the law contemplates and what it allows is for a physician, if there is a long-term working relationship with a nurse practitioner, and if that nurse practitioner has demonstrated over time a great degree of expertise, it allows those two individuals on a contract basis to define the scope. So, rather than trying to hammer into a one-size-fits-all, these are a list of things that nurse practitioners can do, it makes it more flexible and dependent upon what the supervising physician is comfortable with.
Well, thank you for clarifying that. On that note, let's take a break. You're listening to Medicine on Call. This is Dr. Elena George from Medicine on Call. When I wrote my book, Big Medicine, I wanted readers to learn both how the healthcare system works and how to navigate the system to make it work for them. A supplemental policy from Aflac is a little-known but effective strategy to help cover costs of routine medical and dental care and catastrophic care such as cancer, kidney disease, heart attacks, and stroke. Imagine buying a policy that will pay you if you are diagnosed with a catastrophic medical condition or you need emergency care, no questions asked. Whether you're a small business owner who wants to cover your employees or you have a high deductible plan, buying supplemental policy provides coverage you can actually count on to be there when you need it. It also covers preventative care such as mammograms. Imagine being paid to stay healthy. It's a no-brainer. Learn more by texting PAID to be healthy to 36260 or go to www.aflac.com/Stephen_money.
This is Lawyer Liz. Join me each week as we discuss drones, the Internet of Things, and all the technology in between. It's Buzz Off with Lawyer Liz, Wednesdays at 2.
This is Dr. George from Medicine on Call. Healthcare reform is confusing, but one thing has become obvious. Whether it's finding an affordable insurance plan, keeping your doctor, or being able to afford needed prescriptions, navigating the healthcare system has become a challenge. With the loss of the Obamacare mandate, those needing help can now choose an affordable alternative. By joining Liberty HealthShare, you'll become part of a community of health-conscious Americans all over the country who want to control their own healthcare costs and choices. Liberty HealthShare is not insurance. It's an association of self-pay patients who unite with like-minded people to share their medical needs. Neighbor helping neighbor. Medical, surgical, and some alternative holistic treatments are covered without restrictive doctor and hospital panels. Plans start as low as $107 a month for an individual and $345 a month for a family. Healthcare without the hassle. What a simple concept. Learn more now by going to libertyoncall.org or call 1-800-714-6993.
You're listening to America's Web Radio on the AmericasBroadcastNetwork.com. Thank you for listening.
Welcome back to Medicine on Call. We're speaking with State Senator Tom Davis of South Carolina, co-author of a bill S-345, which expands the scope of practice for nurse practitioners. And before the break, Senator, we were talking about the fact that there are the doctors and nurses together collegially decide what services the nurse is going to offer. I just want to clarify, in terms of the bill, can any nurse practice without such an agreement in place?
What can they do without such an agreement in place? Is that the question, Dr. George?
Can they practice without such an agreement in place? So there is no doctor.
I mean, for instance, the bill allows nurse practitioners, independent of that written agreement, to provide non-controlled prescription drugs. They can refer a patient to physical therapy. They can pronounce death and sign death certificates. They can issue an order for a patient to receive hospice care. They can certify that an individual is handicapped. I mean, those are all things that they can do independent of the authorization that's in the written practice agreement. And that's why I say, really the linchpin of this bill is the written practice agreement portion of it, in that's really on a case-by-case basis and dependent upon, the confidence that a physician has and the expertise that the nurse practitioner has. It really gives them a chance to fashion a way of providing health care that I think is really going to serve South Carolinians well. And it's important to understand, Dr. George, where we are here in South Carolina right now. We rank 44th in overall health, according to United Health Foundation's health report, and that translates to an F. And parts or all of the 46 counties in South Carolina are officially designated as medically underserved. We have 8 counties without any OBGYN physicians. We have 19 counties that have 10 or fewer family physicians, 7 counties that have less than 5, and we actually have 1 county that doesn't have a primary care physician at all. I mean, so what we're talking about here is not letting the perfect be the enemy of the good. I mean, obviously, in the best of all worlds, there would be medical doctors and physicians located throughout South Carolina, even in rural areas, and everybody would have immediate access to them. But that isn't the reality on the ground here in South Carolina. We only have 3,500, primary care physicians in the state. And with the 3,600 nurse practitioners we have, if you go ahead and start to unleash some of the potential there, if you allow them to provide the level of care that they're trained to provide, you can really effectively serve some areas that are right now going without health care services at all. So, I mean, that's really the objective here. And there's always going to be things that a physician has to do, and it certainly is always the choice of somebody to have a physician render the care as opposed to a nurse practitioner. But at its heart, too, you know, part of what this legislation says is you as the consumer, you as the individual, when you have a problem, when you have a health care need, I mean, this allows you to determine the level of need or level of access and care that you want to secure. So there's a liberty component to this as well.
Well, I noticed, and correct me if I'm wrong, but there's a clause in the bill that states that if a nurse is not, or I should say, whoever's, I'm going to try to put this in a nice, PC way, but you can't say that you're a doctor and you're not, and that would be grounds for some sort of punitive.
Absolutely. I mean, there's a consumer protection component to this, and you know, one thing you absolutely do not want, and the legislation expressly prohibits nurse practitioners, whether they're advanced or regardless of the degree they might hold, they can't hold themselves out as being a physician. I mean, that's absolutely clear. And I don't want to try to make the argument, and sometimes it devolves into that, you know, are nurse practitioners as qualified as physicians are? And I think we can just stipulate that medical doctors have far more training, and they have a far broader range of expertise. But the fact of the matter is, in a large number of cases, a lot of the emergent needs of people, especially in regard to preventative health care and this routine health care, a lot of times that is something that can be handled very competently and relatively less expensively by a nurse practitioner. And in a free society where individuals are free to make their own choices, as long as you don't have people misrepresenting themselves, as long as the consumer knows exactly the level of care that they're getting, they ought to be free to choose that level of care.
Oh, I agree with you. But I think part of our problem in our society is that it's not clear, and that there's a lot of misrepresentation, and it's cloudy as to what the difference.
Yeah, and I think, you know, to the degree that that's the case, and you're right, we need to be very clear that individuals are not authorized or do not, in fact, represent themselves to be something that they're not. And this law provides that is a violation of the code. There would be civil liability for any nurse practitioner that held themselves out to be a medical professional. I mean, so that's really the best you can do in society, is to go ahead and provide liability for bad acts. And, you know, in the instances where people go ahead and exceed their scope of authority, they would be subject to liability to that patient.
Yeah, well, that's good news, because, I mean, at least it's not a Wild West that way.
That's right.
But have you thought about the other side of the coin here? You know, the medical education in our country has been damaged. I mean, there's the Balanced Budget Act of 1997, which limited the number of residency spots throughout the country. So are you aware that there are thousands of doctors who've graduated from medical school but cannot get a residency and therefore cannot practice medicine? And that whole cohort would be able and willing to go into any state, into any rural area, and actually provide services.
You make an excellent point, Dr. George, and I think in terms of addressing our health care issues in America and in the country at large, we have focused in on the insurance aspect of it. We have focused in on providing individuals with coverage, quote unquote. And that's what the Affordable Care Act was all about. But what we really haven't done is focused on the supply side of the equation. We haven't broken down the barriers to individuals who want to provide services, and you put your finger on one of them. And I think that any approach to addressing health care in our country and to improving access and to driving down prices, quite frankly, is to remove those barriers to providers, to individuals who are trained and ready, willing, and able to provide that health care. I think it's a far better public policy to focus on the supply side of the equation, to actually get more individuals out there, whether they be physicians or physician's assistants or nurse practitioners. I mean, get them out there and break down the barriers, because I think that's the most effective way to address access and cost.
Well, I tend to disagree with you on that one. When I've seen, and I can tell personally from experience of having patients who have seen nurse practitioners, gone to urgent care, less trained individuals, there's a lot of misdiagnoses that go on. I just drained a tonsil abscess yesterday from a patient who went to an urgent care for over a week, treated with the same antibiotic, and then when the culture was negative on a steroid, not knowing that just because your culture is negative, it could be a false negative. So now you have injected more cost into a system, more morbidity into a system because of lack of knowledge. We're not all the same, and I think that one statement actually is not, it does a disservice to the patient. I'm seeing the front line. I'm sure you've spoken with doctors about the same problems. We're all part of a healthcare team. That's not a question. The question is what should be the scope of practice? What should be where boundaries are set? Just because you can doesn't mean you should. And there's been this mindset that the mid-level providers are cheaper than physicians. It's not true. Because when you start talking about tests ordered, about diagnoses missed, about medications that shouldn't be prescribed, for example, it ends up costing the system more. And we're seeing now the hospitals are actually changing their workforce. In Texas, they've fired a whole group of pediatricians, and they're replacing them with nurse practitioners. It's because it's all about cost on the corporate setting. And this is kind of a system that's geared to push hospitals, urgent cares, other healthcare providing services to use the mid-levels as cheaper labor.
I don't necessarily think we're saying different things. But I think you have to understand that in South Carolina, and I'm not sure how it is where your practice, Dr. George, but in South Carolina, again, we have many counties that have a severe lack of physicians. And you point out that a lot of physicians are prohibited or barred from providing services because of regulations. But the fact of the matter is, in South Carolina right now, we have some counties with no OBGYN physicians, 8 of them. We have one county with no primary care physician. We had a law that actually said that if you're a nurse practitioner, you couldn't provide care 45 miles outside of where a doctor was, even though telemedicine was available. What this legislation does is it allows nurse practitioners to avail themselves of telemedicine techniques. It allows physicians and nurse practitioners now to have that relationship and to use telemedicine and to break down those radius requirements. So I don't disagree with you. There's always going to be instances where a medical doctor has to be the one that renders the care. And I think you make a good point that we have to guard against having the mean descend, and we just simply move away from a system where physicians are involved and move solely toward lower-cost providers. That's not the objective here at all. The objective here is to allow individuals who are trained to provide a certain range of medical services, as nurse practitioners are, with the requirement that they have a master's degree, to allow them to do the things that they are trained to do, and nothing more than that, unless the physician and the relationship of the nurse practitioner in the written agreement says otherwise. So I don't think we're saying different things, but you make a good point that there are always going to be abuses, there are always going to be bad outcomes, and we have to go ahead and be aware that takes place. And if there has to be a tweak to the law, or if there has to be an amendment or a codicil to guard against that, I'm open to having that done.
I think that's a really good point. Let's take a small break and come back. You're listening to Medicine on Call. Do you have a problem with the feeling of something stuck in your throat, throat tightness, bad breath, a chronic cough, or frequent throat clearing? Maybe you have acid reflux, which is a common problem. Or maybe you have persistent ear pain, ear clogging, or ringing in the ears, but have been told you don't have ear infections. Perhaps it's because you grind your teeth at night. Sometimes the symptoms don't seem to be connected to an underlying problem. Sometimes the answer to a nagging symptom that doesn't go away or respond to treatments can be found by having your doctor give you the time to explain exactly what's going on in order to discover the root of the problem. This is Dr. George from Medicine on Call. I believe in taking the time to perform a thorough examination, discuss the findings, and answer your questions, because I believe that our patients are empowered when they're given all the treatment options. It's simple. When you understand the problem, you get to decide which treatment option works best for you. It's all about the power of choice, because Peachtree ENT Center is where patient care counts. For more information or to make an appointment, go to www.peachtreeentcenter.com. That's peachtreeentcenter.com. peachtreeentcenter.com.
You're listening to America's Web Radio on the AmericasBroadcastNetwork.com. Thank you for listening.
Welcome back to Medicine on Call. We're speaking with State Senator Davis from South Carolina, who's let me ask you, Senator, is the bill now a law? Has it been signed by the governor, or is it?
It has.
Okay.
It was signed by the governor a few days ago. Okay. It takes effect, I believe it's July 1, which is the beginning of the new fiscal year in South Carolina. So you've got a little bit of lead time for the industry to kind of adapt or adjust to what the new rules and regulations are going to be in regard to what nurse practitioners can do. But yes, Governor McMaster signed it into law, and it will take effect at the beginning of our fiscal year on July 1.
Well, I've been looking, there's a lot of information out there from various sources, but one struck me that there's an argument that she mentioned before the break that there are counties that aren't served by anybody, and that nurse practitioners would step into the breach. But when you look at all of the states that have given nurse practitioners more leeway, more latitude, they still congregate in the same areas that physicians are. So they're not going out to rural areas. They're not the only game in town, and that doesn't seem to make a change in the status quo.
Well, that's why, and you're right, has been the dynamic elsewhere, and that's why we specifically inserted into this particular legislation that advanced nurse practitioners must serve in rural or underserved areas, and underserved areas are defined in the bill as being areas where you've got a certain percentage of individuals who are on public assistance, or a certain number of physicians aren't in that county. So we expressly state in this legislation that advanced nurse practitioners must, and that's a requirement, provide services in those underserved rural areas. Because you're right, it's natural economics for individuals to gravitate and to be into areas when there's a more readily accessible pool of customers, right? So one of the things that we wanted to do with this bill, and one of the ways that I really promoted it and explained it and championed it in the state Senate, was that it was going to be a way to address the shortage of health care services in our state's rural areas. And so that express provision in the legislation was something that was very important to me.
Well, let me also expand this and play a little bit of devil's advocate.
Okay.
The people in the rural areas generally are the least served medically. They have the most complicated medical conditions because they've gone on for in some instances years without somebody being able to address them.
Right.
You're putting a workforce technically into an environment where the medical problems are complicated and complex. Does that give you pause?
No, but remember, we're not putting them in there alone. We're not putting them in there without there being a supervising physician. There's still the responsibility that each nurse practitioner has to have that physician with whom he or she works. There has to be that written agreement that specifies what that nurse can do. It requires the physician, even in cases where the nurse practitioner is rendering that care, it requires that physician to be there in a collaborative role. So it's not a situation where we're simply saying to nurse practitioners, okay, go out into rural areas and do whatever you can without any assistance. It all ties back and it all, plays into this notion of collaborative working between physicians and nurse practitioners. And let me be very clear, this is not an independent practice bill. This is not a bill that allows nurse practitioners to hang their own shingle out there and provide medical services to people, whether it's in rural or urban areas, without the collaborative participation of a medical doctor. So it's very clear to understand. I know that some areas do have independent practice statutes. They do allow nurse practitioners to hang out their own shingle. That's not what this bill does, though, and intentionally so, it does not do that. It requires that collaborative approach. And the thinking here is, if you can have a strong collaborative team, if you can have a medical doctor and a nurse practitioner, advanced nurse practitioner, with a very specific written agreement defining what that nurse practitioner can do, that is a very effective way of providing health care services into underserved rural areas.
Well, I see where you're going with it, but in real time, on the front line, that's not exactly what goes on. So you have a doctor miles away from a nurse by telemedicine. It's not quite the same thing as being next door to the nurse practitioner, having a consultation outside the patient's door, the doctor going in and actually laying hands on the patient and making an assessment.
No doubt. There's nothing that can substitute for a doctor and a patient being in the same room and making that diagnosis. But what I'd point out, Dr. George, is, I mean, we got to be careful not to let the perfect be the enemy of the good here. And again, we're not talking about a situation where we've got medical doctors or physicians in rural areas that can lay hands on and have that immediate relationship with patients. And so I take your point. I mean, it's never going to substitute and never be as good as a situation where a person can actually be in a doctor's office and have that one-on-one immediate, attention. But again, what we're dealing with here in South Carolina is a crisis situation in rural areas that are completely underserved, and we have to be careful not to let the perfect be the enemy of the good in this particular case.
I totally understand your heart is in the right place on this. I do, and I appreciate that. But there's even studies now that have come out from, an ER, the Emergency Physicians Monthly, put out a study about doctors and their interaction with mid-levels, and there's a majority of doctors who don't interact with the mid-levels, right? They say they do, but they really don't. So there's this perception that there's oversight, but there's not as much oversight as you might think.
Yeah, and that came up during the subcommittee process that, physicians will simply sign up and say, yes, they're supervising nurse practitioners and collect a monthly fee for doing that, but then in reality don't in fact provide that supervising, and that's a great point. And what we tried to do with this legislation, again, to guard against that, was to require these written practice agreements, to expressly require that there be regular communication between doctors and nurse practitioners so that it wasn't something just in form and not reality. And I think the points you're making are well taken, and any time you change public policy and any time you change the way you go about doing business, it's always important to look at what actually happens as a result. What's happening on the ground? Are there abuses? Are people getting good access to health care? And I think that to the extent that there are shortcomings or to the extent there are abuses, we need to address that in subsequent legislation. So this isn't sort of like, okay, we're going to go ahead and hand down these tablets from on high, and this is the way it's going to be for all time. Any time in public policy and legislation when you're changing the established way of doing things in a certain way, you've got to look at what the actual consequences are and then be ready to come back as a legislator, and if you've made a mistake, to frankly admit it and take steps to correct it.
Well, that's good to know, because the trend now is replacement of physicians in hospital setting. Whole emergency rooms are now being run by nurse practitioners and physician assistants. I can tell you I'm an independent doctor practicing here in Georgia, and people go into the ER now, they're not getting treated, they're getting a referral to go to a private doctor for treatment. That is not providing care. That's costing the patient a lot more money than they should have to pay, and they're taking longer to get care. I mean, so something I would think, hopefully, needs to be put in place that the actual, the place of service is staffed accordingly. We've had whole ERs at this point that don't have ear, nose, and throat coverage, neurology, OBGYN. How do they call themselves ERs and people roll up with those problems and they have to be shipped elsewhere? These are things to me that we really do need to start addressing. Because
you make some excellent points, and quite frankly, I wasn't aware on the supply side of the equation, because again, as a free market person, I'm always looking at addressing things from a supply and demand standpoint, and frankly, I wasn't aware until talking to you just now, Dr. George, that there are these impediments to more physicians coming into the healthcare sector. And so I think what I'm hearing you say, and I'm in complete agreement, that if there are barriers or if there are restrictions or things that are preventing, doctors and physicians from actually coming in and being able to provide these cares, we need to break down those barriers as well. I mean, this isn't a silver bullet. I mean, and nothing with healthcare is going to be solved with one single initiative. So all these things need to be done. And so you make some excellent points. I mean, in regard to if there are, in fact, situations where medical doctors aren't available or in settings where you would expect them to be available, they, in fact, are not, we need to figure out why that's the case and then break down those barriers to make sure that situation doesn't occur.
I totally agree with you. I mean, the Affordable Care Act is a complete, example of unintended consequences.
Right.
When you read that law, they spend a lot of money on educating mid-levels, on medical assistance, on the allied healthcare professionals. Absolutely nothing was spent on increasing the number of residency spots for doctors.
Well,
nothing.
I think you put your finger on a major public policy defect in that particular legislation, and I'm in complete agreement that it needs to be addressed as well.
I know. My thing is we don't have to recreate the wheel, right? We have a pool of physicians, doctors, graduated from medical school, passed their training, their postgraduate exams, but because they can't get a one-year residency, they're out there doing other things.
Right.
Though you could find OBGYNs to go into your rural areas. You trust me, you would have doctors flooding South Carolina, ready and willing and able to help you, and actually act like mentors or work with physician agreements with the nurse practitioner, so they're not so far away from doctors.
Have any states, and I guess I'm not supposed to be the one asking questions, but I'm wondering if any states have initiatives, to try to break down that difficulty to get residencies in order to get a greater supply of physicians, and I'll look into what state level public policies can be advanced to address that problem, because you're drawing attention to something that is of great concern, and now that I'm thinking about it, we need to go ahead and make sure not only that nurse practitioners and physician's assistants are allowed to provide the care they're trained to provide, we need to break down some of these barriers or some of these impediments to physicians being able to serve areas as well.
I think it all works together, frankly.
It does.
If you have more doctors to be available to nurse practitioners and physician assistants, they wouldn't be out there on a limb. I've actually spoken with nurses, registered nurses. When we started changing the workforce, the face of the workforce, a lot of my friends who practiced for 20, 30 years, that were nurses in the ICU, etc., left, stopped nursing because they felt that they were being forced to do things they didn't feel comfortable with.
Right.
Putting in lines, running ICUs without a physician there to oversee. That's not fair to them either. Even
Absolutely.
though the mindset is nurses are equal to doctors, that's what the general push is being made.
Yeah, and I can understand how, sometimes large corporations or hospitals or medical companies are just focused on the bottom line and interested in providing, care at the lowest, cost level so that they can maximize profits. I agree with you. I think if that dynamic is holding sway, and if you have a situation where nurse practitioners are being forced into areas that, quite frankly, they aren't trained and not comfortable, I think you're going to find the advanced nurse practitioner community pushing back, because that is not what they want either. I mean, all that they want is, to the extent they were trained to do something, if they have the ability to do something, they want the ability to develop a relationship with the doctor that allows them to do that. I think they would be equally uncomfortable with a situation where market forces are driving them to actual providing services that they weren't qualified to provide. So I'll be watching out for that. I quite frankly wasn't aware that was such a prevalent problem, but you make a great point in that regard, Dr. George.
Oh man, it's a huge problem, and I've done contract worked medical work throughout the country, and one of the things I'm struck by when I'm covering an emergency room, whether that's in Maine or New Mexico, I've been around a lot of places, so I've seen a lot of delivery systems. These folks are coming from 100 miles away for ENT services because their ER doesn't have one, or no neuro. I mean, these are airway emergency, right? Emergency tracheostomy. You cannot be in a situation where there's not enough help to get things done because patients die.
No question. No question. I mean, it's an all-of-the-above strategy, right? I mean, it's not just about empowering nurse practitioners to do what they're trained to do. It's also about allowing doctors to do what they're trained to do and removing the impediments to them being able to do so. And so I think we're saying the same things, and, it's important in any legislation, and I think as policymakers sometimes we tend to pass a law, then sit back, and be satisfied and say, okay, well, we fixed that problem. That's not the case with good public policy. You're constantly looking at, okay, what was the effect of what we passed? Did it accomplish the objective that we intended? Is there better access to health care? Do we have nurse practitioners providing care that's within the scope of what they're able to do? Are there abuses? And then to come back and to make changes if appropriate. So this is an ongoing process. And again, I would say this, that this particular bill, the one that was signed into law here in South Carolina, in the spectrum of things, when you're looking at this particular issue, it's a fairly conservative bill. It does not establish independent practice. It emphasizes criminalizes the written agreement between a physician and a nurse practitioner. It is very clear that nurse practitioners aren't supposed to provide acts that medical doctors are to provide. So it was our attempt to begin the process of allowing nurse practitioners to do more things, but I'll keep an eye out for those unintended consequences that you mentioned, Dr. George.
Thank you so much. On that note, let's take a break. You're listening to Medicine on Call. This is Dr. Elena George from Medicine on Call. When I wrote my book, Big Medicine, I wanted readers to learn both how the healthcare system works and how to navigate the system to make it work for them. A supplemental policy from AFLAC is a little-known but effective strategy to help cover costs of routine medical and dental care and catastrophic care such as cancer, kidney disease, heart attacks, and stroke. Imagine buying a policy that will pay you if you are diagnosed with a catastrophic medical condition or you need emergency care, no questions asked. Whether you're a small business owner who wants to cover your employees or you have a high deductible plan, buying supplemental policy provides coverage you can actually count on to be there when you need it. It also covers preventative care such as mammograms. Imagine being paid to stay healthy. It's a no-brainer. Learn more by texting PAID to be healthy to 36260 or go to www.aflac.com/Stephen_money.
This is Lawyer Liz. Join me each week as we discuss drones, the Internet of Things, and all the technology in between. It's Buzz Off with Lawyer Liz, Wednesdays at 2.
Do you have a problem with the feeling of something stuck in your throat, throat tightness, bad breath, a chronic cough, or frequent throat clearing? Maybe you have acid reflux, which is a common problem. Or maybe you have persistent ear pain, ear clogging, or ringing in the ears, but have been told you don't have ear infections. Perhaps it's because you grind your teeth at night. Sometimes the symptoms don't seem to be connected to an underlying problem. Sometimes the answer to a nagging symptom that doesn't go away or respond to treatments can be found by having your doctor give you the time to explain exactly what's going on in order to discover the root of the problem. This is Dr. George from Medicine on Call. I believe in taking the time to perform a thorough examination, discuss the findings, and answer your questions, because I believe that our patients are empowered when they're given all the treatment options. It's simple. When you understand the problem, you get to decide which treatment option works best for you. It's all about the power of choice, because Peachtree ENT Center is where patient care counts. For more information or to make an appointment, go to www.peachtreeentcenter.com. That's peachtreeentcenter.com. peachtreeentcenter.com.
You're listening to America's Web Radio on the AmericasBroadcastNetwork.com. Thank you for listening.
Welcome back to Medicine on Call. Today we're talking about the law now in effect in South Carolina, S-345, co-authored by Senator Tom Davis. And Senator, I really just want to thank you so much for your willingness to listen and to learn. I mean, this is something that's involved that affects patients, and patients should be the focal point of everything. Not doctor and nurse ego, not physician assistant ego. We're deliverers of this system to patients, and it needs to work better.
And that's one of the things that I was struck by during the subcommittee process, is just how dedicated and committed medical professionals, physicians, nurse practitioners are to patients. I was truly struck by that. And again, as a policymaker, you have to listen very carefully to the people who are actually carrying things out. So I appreciate that sentiment.
Well, from an independent doc, out there on the front lines, it's one of the things that we as physicians, I don't know if you have the experience, but we're frustrated by the fact that nobody seems to listen to us,
Right.
And everybody's talking at us, and we seem to be the problem. We're the problem of the cost. We're the problem with the no access. It's all laying on the feet of the doctors, and actually, we're not. And we want to.
And my experience in this process was not that at all. I mean, the South Carolina Medical Association and the physicians, I mean, they were extremely cooperative and forthcoming in this process. And this truly was a collaborative bill. It wasn't, legislation that was passed over the objections of physicians. I mean, the physicians were at the table along with nurse practitioners, and they agreed on all of these things. So your point's well taken. You have to have input from those experts and those people that are actually in the field.
but it has to be the range of experts, not just academicians, not just doctors who are on the staff of hospitals who are getting a paycheck and are part of the corporate system,
right,
but the independent doctors who are out there who have to see patients and make it work, right? That means people who are paying cash, people who barter, people who have direct primary care practices. We are actually part of the solution.
Absolutely.
All right, so if you're trying to engage an entire health delivery system, everybody has to have a voice. And the fact that you unfortunately didn't know that there are doctors out there, thousands literally, who are dying to practice their art. They spent all this money training and they can't get a job
because of residency or a lack of residency positions. Is that correct?
Yeah, but if I'm not sure if you know how our process works. It's 4 years of medical school. You have to pass three sections of a board, part 1 and 2 and 3. But in order to license, you can pass everything. But if you don't do 1 year of residency,
right,
you cannot be licensed, period.
Right.
That means you'll never be a doctor. There should not be any doctor who's graduated in our country who can't work because of that.
I agree completely.
And I think that's probably part of the genesis of the doctor shortage and the lack of health care in rural areas. It stems from not having enough people and then needing to think outside the box, expand it, extend it. I know the genie's not going back in the bottle, but we do need to make sure that it doesn't go so far off the track of patient care that we can't get it back. If it took me six years to do ear, nose, and throat as a postgraduate training, once I leave practice, if you don't have other ENTs coming behind me, you lose a whole section of patient care that can't come back, and that cannot be filled in by mid-level providers because we train differently, right?
Understood.
So everybody has a role and a purpose, and a specialist is just as important as a primary care doctor. Primary care doctor is just as important as a mid-level provider. Everybody has to be in the soup. And I agree with you. I'm a free market person myself. Let the patient choose who they want to see. But their choice shouldn't be made for them because of absence or lack of. Then you've taken their choice away from them.
Fair point.
So, I really... what does your other colleagues think about this law?
Well, I mean, there was a lot of attention that we paid to the prescription process. I mean, as you know, right now we have an opioid crisis, and everybody's radar, is in regard to, okay, are we opening the floodgates to controlled substances being put in the hands of people for abuse? And so a large portion of this legislation deals with what sort of prescriptive authority that nurse practitioners can have. And we were very detailed in this regard, requiring the nurse practitioner to petition for prescriptive authority, requiring that there be a specific written agreement with a physician, allowing it to include Schedule II non-narcotic substances only if they're in the practice agreement, allowing Schedule II narcotic substances if it's in the practice agreement, but limiting the prescription not to exceed a 5-day supply. I mean, so we really went out of our way to make sure that we weren't somehow opening up the floodgates, for opioids or opium-based medicines to get into the hands of people who are going to abuse them. And so a lot of the debate and a large portion of the bill focuses on how do we control that? How do we make sure physicians are involved? How do we make sure that this particular prescriptive authority isn't abused? And again, this is an example, Dr. George, of let's see if what we did accomplishes the objective. Let's see if it goes ahead and facilitates the access to health care, but at the same time doesn't create a prescriptive opioid problem. And I think everybody is committed. All the doctors and all the nurse practitioners and people that worked on this bill are committed to looking and seeing how it works in practice and then coming back in to make changes if necessary. So I think that's the point that I would leave your listeners with is in public policy, whether it's at the federal level, state level, passing a bill is rarely, if ever, the end of the matter. You always have to see how it works in practice, and you always have to have an open mind and a willingness to make changes if necessary.
I really appreciate that. I wish the federal level would work that way.
Well, unfortunately, we tend to look at things as a zero-sum game, that certain parties win and certain parties lose. This is a case where we want everybody to win. We want the patients to win. We want there to be enough physicians to provide care. We want advanced nurse practitioners to provide the level of services that they're able to provide. We want physicians' assistants to be able to do so. But what you're saying, I think, is the same thing I'm saying. We want to make sure that the patient's interests are well served. And I think that's the approach we have to have with anything in this regard.
Well, you're speaking music to my ears because it's all about us listening to each other.
Absolutely.
Right?
I mean, this is not a situation where you've got battle lines drawn in competing camps and one side wins and one side loses. I mean, the objective here is to have the patients win. And my experience in South Carolina here has been exactly that. I mean, the physicians, the nurse practitioners, the physician's assistants, the hospital association, I mean, everybody, I was impressed with the fact that they did have that objective in mind. It wasn't about economic turf. It wasn't about preserving an economic advantage. It was all about how can we increase the level of health care access and how can we make sure it's quality access.
Well, I think that we can agree on the fact that it has to be everybody involved. It cannot be just one-sided. And that would be, to me, the linchpin or the foundation. There's respect for each other.
Absolutely. It's a collaborative effort.
Exactly.
Everybody has their role to play in this.
There's no devaluation of anybody.
None at all.
Right? And that would make it better for the patient.
Absolutely. You and I are saying the same thing, Dr. George.
Well, let me tell you, if you ever need my help in anything or you have a question, I want to be a resource because I love what I do. I was born to be a physician, and I can speak of thousands of doctors who believe what I do, that we just want to be able to help our patients practice the Hippocratic Oath and provide a service. And we don't want things that encroach on that, interfere with that, or obstruct it.
Understood.
And if we need to be in with you guys to help craft legislation, then you have, a whole cohort of doctors who are willing and able to give you, their experience, so your frame of reference becomes larger.
Right. And this particular bill that passed is just the beginning of a larger conversation. And what you've just said is something we need to keep in mind as we move forward.
Well, I just want to thank you again for your time, and call me if you need me. I would be happy to be a resource. And anything else that comes down the pipe, I'm looking forward to having you back on.
Great. I enjoyed our conversation, Dr. George.
Thank you. Have a blessed day.
You too. Bye-bye.
And thank you for listening to Medicine on Call. Do you have a problem with the feeling of something stuck in your throat, throat tightness, bad breath, a chronic cough, or frequent throat clearing? Maybe you have acid reflux, which is a common problem. Or maybe you have persistent ear pain, ear clogging, or ringing in the ears, but have been told you don't have ear infections. Perhaps it's because you grind your teeth at night. Sometimes the symptoms don't seem to be connected to an underlying problem. Sometimes the answer to a nagging symptom that doesn't go away or respond to treatments can be found by having your doctor give you the time to explain exactly what's going on in order to discover the root of the problem. This is Dr. George from Medicine on Call. I believe in taking the time to perform a thorough examination, discuss the findings, and answer your questions, because I believe that our patients are empowered when they're given all the treatment options. It's simple. When you understand the problem, you get to decide which treatment option works best for you. It's all about the power of choice, because Peachtree ENT Center is where patient care counts. For more information or to make an appointment, go to www.peachtreeentcenter.com. That's peachtreeentcenter.com. peachtreeentcenter.com. This is Dr. George from Medicine on Call. Healthcare reform is confusing, but one thing has become obvious. Whether it's finding an affordable insurance plan, keeping your doctor, or being able to afford needed prescriptions, navigating the healthcare system has become a challenge. With the loss of the Obamacare mandate, those needing help can now choose an affordable alternative. By joining Liberty HealthShare, you'll become part of a community of health-conscious Americans all over the country who want to control their own healthcare costs and choices. Liberty HealthShare is not insurance. It's an association of self-pay patients who unite with like-minded people to share their medical needs. Neighbor helping neighbor. Medical, surgical, and some alternative holistic treatments are covered without restrictive doctor and hospital panels. Plans start as low as $107 a month for an individual and $345 a month for a family. Health care without the hassle. What a simple concept. Learn more now by going to libertyoncall.org or call 1-800-714-6993. Neighbor helping neighbor. Medical, surgical, and some alternative holistic treatments are coming.
Welcome to Buzz Off with Lawyer Liz on America's Web Radio. I'm your host, Lawyer Liz, and while I am an attorney, the Buzz Off show is not legal advice. Instead, it's a weekly look at all of the buzz surrounding drones, autonomous vehicles, the Internet of Things, and all of the gadgets and gizmos and technology in between. Catch us each Wednesday from 2 to 3 in the afternoon Eastern on America's Web Radio, or find the Lawyer Liz podcast on iTunes or your favorite podcast streaming service. And as we're about to head into Memorial Day weekend and the unofficial kickoff of summer travel, not to mention in the information security world, you've got summer camp and all of the other conferences later in Las Vegas. Well, what do you do when you travel, and how do you keep your, not only your personal information and devices secure, but also your business devices, as well as just general travel and safety tips? Well, we'll be joined later in the show by Christopher Burgess, who has launched a new project that seeks to address all of that information, or all of those questions, called Securely Travel. It's securelytravel.com, bringing together years of research and work both as a traveler, but also in his roles in various information security positions, both with the federal government as well as leading industry or leading companies in the industry. Well, before we get to that, you got to look at what is going on. If you've been walking around Atlanta, I saw this in San Francisco. Apparently you won't find it in Nashville, though, because Nashville has said no thank you. But all these scooters that are popping up on the sidewalks, I guess it's the latest trend that's what's old is new again, but the Bird scooters. So that's up for grabs and discussion, as well as some of the latest in autonomous vehicle testing news, as well as Amazon's Rekognition project, and some news, of course, on Uber and Lyft. But getting back to the Bird scooters, where you have all these, it's kind of the on-demand transportation services where these random scooters are just sitting on the sidewalk, and using the app, you can find the nearest scooter, you can activate it for a small fee, and then you pay by the minute for its use. What is not part of that equation, though, are, well, helmets and basic safety. The scooters go zipping down the sidewalks and have led to injuries and a rise in bumps and bruises. Apparently, we are not as young as we think we are, in the sense of where we could bounce back quicker as kids. Well, we're not bouncing back as well. And also, while the app does just as Waze does, when you go to use the app, it confirms you need to use it in accordance with Waze asks you, are you a passenger? Are you the driver? And, don't use while operating the vehicle, that kind of thing. Well, the Bird app asks, follow the safety rules of the road, but people aren't listening, which has led Nashville to say, no, thank you. But can they stop what's coming? Just as we saw with Airbnb and Uber and other ride-sharing services. Well, that's not always the case. The technology is coming. It's more the education. While some of the Bird and some of the other companies offer the ability to request, you can request a helmet. They will send one to you, but whether you actually wear it or not. And while the scooters themselves, just with bike sharing services, you've got the bikes ready and docking charging stations where you can use it. You don't have, not everybody carries a bike helmet or a helmet for scooters in their bag. So how do you solve that issue? Bird and some of the other services will send you a free one if you request it, but that means you've now got to carry it with you, much as seen with skateboarding and some of the other rollerblading, carrying the necessary safety equipment, not to mention the devices themselves. So be curious to see how that goes forward. But when you have the hits keep coming for Uber and Lyft as well, when it comes to the reports of sexual assault and some of those, the darker, seedier side of the Lyft services, Congress is asking for information on the reports of sexual assault and those crimes. But Lyft did announce a neat program where they're going to be rolling out investments in their drivers, offering oil changes, other services, different options for renting the cars that the driver's using. But that's an interesting change, slightly away from the strict model of it's your car, we're just connecting you with a rider. Well, when it comes to connecting riders and faces in a crowd, Amazon is taking some heat for its facial recognition software programs, where, as the ACLU noted in a blog post, it has the potential to build a system that would automate the identification and tracking of anyone, anywhere, anytime, that you have a right to gather in a public space or even just walk down the street without the government necessarily tracking that every movement. The Amazon has been promoting the recognition service, the facial recognition service, to police departments and public safety operators. And Oregon has been utilizing this. And as with any technology, the learning curve is steep, not setting aside the privacy and other concerns. But when an open records request shows that a picture of O.J. Simpson was matched to a white dude with a mustache as a 93% match, the technology still has a ways to go, but it will be interesting to see how Amazon addresses some of those concerns. I mean, at the same time, with the other Amazon delivery services and connected cameras and all of the digital personal assistants, well, Amazon already has all of our information and data. Anyway, let's see where that goes. But speaking of where things go, autonomous vehicles are certainly taking up the news and getting a rollout from, in this case, Sacramento has announced that they'll be testing driverless cars via Phantom Auto, rolling those out, the test out, hopefully starting in June, but they'll be using 5G Verizon internet connection to test the vehicles. Jacksonville, Florida has announced the test track for autonomous vehicles, not to mention the projects underway in Georgia. But one of the long-standing issues with autonomous vehicles and driverless cars, regardless of what you're doing with the driving, there's testing to, in one case, make the autonomous vehicles change lanes more closely aligned to how human drivers do it. But all of that requires roads with paving, lane stripes. And one of the areas that has been left out of the mix are rural areas that don't necessarily have paved roads or don't necessarily have the cellular connectivity, despite all of the cellular companies promising you that they have covered 99 or 98%, for example, of the United States. Well, there are areas that do have gaps. There are areas that don't have paving on the roads, or not paving, but the lane striping. The lane stripes have worn off due to weather conditions. Well, Swift Navigation is rolling out testing in the Villages retirement community in Florida that, utilizing GPS technology and GPS systems, hopes to address some of those issues and really solve for what has been one of the bigger problems, that how do you navigate and safely maintain? I mean, you see this even in our famous road trip to DerbyCon with Rob Graham's Tesla, where the sensors couldn't detect the paving due to shadows or other issues. It was a less consistent of a ride. So when you have an elderly population that would greatly benefit from the ability that to, if they want to go to the grocery store, if they want to pick up, to go to the drugstore or go to dinner on their own, that level of autonomy from an individual perspective and meshing it with autonomy and autonomous driving in cars, it's going to provide a sense of mobility, not to mention the potential uses not only for the elderly population, but the less able-bodied population, allowing them to have that sense of autonomy back and sense of control. That's going to be great to see if it can come out. As much as I mock the inability or how much I enjoy driving, there are benefits that the technology can bring. And so addressing some of those problems. The other thing is looking for announcement that some of the new gaming controllers will also be coming out that allow those with disabilities to be able to participate in games. I saw some reports of that. That's great news. But as we roll into Memorial Day weekend, where Hartsfield-Jackson Atlanta International Airport is projecting 1.7 million passengers to come through the airport. Well, how do you address all of that travel and keeping your information, your devices, your data secure? How do you pass through borders? How do you travel through Mexico, as Christopher says, without getting shot? Well, our next guest, Christopher Burgess, will share how he's looking at those issues with Securely Travel. We'll be right back after this commercial break. You're listening to Buzz Off with Lawyer Liz on America's Web Radio.
45 years of experience is behind the most trusted name in auto transportation. Passport Transport, the first and finest today. That's why Passport Transport is the preferred auto transport for major auto manufacturers, concours, museums, tours, and collectors, and should be your choice from across the state to across the country. When you have the need, go to PassportTransport.com and enjoy the peace of mind referenced experience will give you. Passport Transport.
You're listening to America's Web Radio on the AmericasBroadcastNetwork.com. Thank you for listening.
Welcome back to Buzz Off with Lawyer Liz on America's Web Radio. I'm your host, Lawyer Liz, and as promised before the commercial break, when everyone starts thinking of summer vacation, as we're about to head into Memorial Day weekend, when the show's coming out, well, it's easy to pack the sunscreen. It's easy to remember to pack the bathing suit, etc. But what is not so easy is to, secure everything else, your data, your information, your devices, and in some cases, your physical security. So the new website that caught my eye is SecurelyTravel.com, and Christopher Burgess is joining us Christopher, you have brought together this wealth of knowledge in security. You've worked in all kinds of business environments, and as a world traveler yourself, it seems like you've come up with the perfect blend for all your interests and background. So welcome to the show.
Well, thank you so much, Liz. It's my pleasure to be here. You're partially right. I have blended my 60 some odd years of life together. I grew up abroad. I worked abroad almost my entire adult life. Right now, I'm in the one locale for the longest period I've ever been, the gypsy in me. But I travel a great deal, and I always go through a ritual before I traveled. I learned that from my dad, because my first time on an airplane, I was like 7 years old, and it was a 707 from the U.S. to Rome. And I sat with my eldest brother, and I found out during that flight that I was, the next best thing to a puppy at attracting the flight attendant's attention.
I imagine so. I have no doubt.
And so learning how to travel is much easier now, because the internet has made the world communication-wise flat, and then the ubiquitous of cruise travel, train travel. We get into our cars and we go, we get on airplanes and we go, they're flying buses. So we just do it. And oftentimes we forget about the things that we would take for granted at home. We would spot the anomaly right away if somebody was loitering in our front yard. But if we're at a hotel, we don't know if that's a loiterer or another visitor. So in our travel mode, I have found over my life's experience, we're at our most vulnerable, because we're out of our comfort zone. Even though we may be comfortable, we're out of that sensory zone where we know where everything belongs, and thus we can spot the anomaly.
Well, and forget even just traveling in an individual, for personal travel, but when you're traveling for work and you've got sensitive information or devices that, quite frankly, connect to sensitive networks, and not necessarily from a national security level sensitivity, but from a business and proprietary. I mean, you've got the keys, in some cases, to your intellectual property. You've got all of these other things. And on a personal level, of course, you've got, we all have our banking apps, or, different things that we've got, not to mention our house key, all of this. It seems like we're more connected, but when it comes to travel, that's not always a good thing.
Well, you hit it on the head there. When we do travel for business, we're traveling to make money or to preserve revenue, depending upon what your role is. And trade secrets are of interest. You can't pick up a newspaper today without a story about somebody stealing somebody else's intellectual property. It just happens with such great regularity. And when you're in travel mode and you're leaving that laptop in the room while you go to dinner, you're also inviting a competitor to break into your hotel room, or a competitor to lift it. I remember a few years ago, I did a video on conference security, and about how when you go into the restroom, don't put your bag on the floor. Why you would anyway, I don't know. But people do, because somebody will walk in behind you and lift it. And I don't know about you, but I can't get off the commode very, very quickly and chase my bag down the road.
No. Or what gets me is I was just in San Francisco, and there were news stories about people leaving, laptop thefts from coffee tables, or this or that, not coffee, but like tables in coffee shops. I'm sitting thinking to myself, who on God's green earth leaves their laptop or some other device and then walks away?
I see it every single time I sit down at a coffee house. Every single time.
Well, and I would notice even at this conference, different colleagues leaving their laptop and walking away to grab to go to the restroom, coffee. I'm thinking, no, just grab your laptop. If nothing else, keep up with that because it's so easy to snag it. So how is Securely Travel providing or kind of addressing these issues?
So, thanks for asking. What we're trying to do right now, we're in phase 1. We're 45 days young. We're stretching our wings, if you will, and we're trying to put out every day a different tip or a discussion about an event that occurred so that folks understand that even though there might be a nasty side to an event, there's also a way to mitigate that risk. For example, we've talked about going to Mexico and enjoying yourself without getting shot, right? And we also talk about, like today's post, I had a guest post in today, and we talked about car ramming, which, just this weekend, there was an instance of it in North Carolina, where you're in the wrong spot at the wrong time, and somebody is ramming a car into something. And are you thinking about it? You need, unfortunately, when we're in crowds nowadays, we need to think about, when I hear that car coming at a high rate of speed or that engine revving, that should be a clue to me something might be happening. And so what I'm hoping to do is inculcate to folks a different way of thinking so that, it's all right, we can go have fun, but we also have to think about the danger that might be there so that when we think about it with foreknowledge, it doesn't surprise us when it occurs. But if we haven't thought about it, those instances where we sit there and go, what the heck's going on here? As opposed to, I read about this. This is what's happening, and I know what to do. I'll give you an example. My wife and I went to Paris. She had read in a guidebook, it was Rick Steves' guidebook, about one of the pickpocket schemes that was used. And we wrote about this on Securely Travel. It's called the bracelet scam. And she knew it was coming. As soon as the individuals started coming up with the bracelet in their hand, she knew exactly what was coming, when it was coming. And she just stopped them at arm's length, said, you can stop right there. Here, let me get a picture. And then we moved along. And then when they saw them going after a single lady walking along, she ran up to the lady and pulled them away from her. And pulled away from the pickpockets. And the gendarme came in and, arrested the guys. And then they walked over to my wife and said, that's pretty dangerous. You might want to just yell, look out, as opposed to get involved. But the fact of the matter is, if you read about it, then you have knowledge. And that knowledge is so powerful because it allows you to be prepared should an event happen to you.
Well, and it seems that you're doing a good job of striking that balance because in my paranoia, so to speak, I refuse to go on a cruise, one of the large cruises. I have too many stories. It's going to be pirates. I'm going to be stuck at sea with no, water, toilets, whatever. But y'all ran a story talking about how on one of the cruises, a burst pipe, it could have, and granted, as far as I'm concerned, the story stopped there. And it's horrible. And that's another reason why I shouldn't go on a cruise. But y'all provided kind of a reminder of the necessity for planning.
Well, you're absolutely correct. These are floating cities, right? You get this cruise ship, you got 2,500 passengers, you got another 1,000 crews, you got 3,500 people floating around in this metal container. And 1/3 of everyone on board is trying to make the other 2/3 very happy the entire time they're there. And I will say this about the cruise industry, and my wife and I, and my parents beforehand, because I am old enough where it was cheaper to go by boat than it was by plane. So I have actually sailed across the Atlantic moving and sailed across the Pacific moving in a tiny boat. But the fact of the matter is, safety is their first concern. And so they're always drilling like they do in the aircraft industry, because like airplanes, Airplanes have to empty that plane in less than 90 seconds. Ships have to be able to empty that boat and put everybody in a boat in a short amount of time. I don't have the exact numbers, but I do know that there have been some horrible examples where it didn't work. And there are some absolutely great ones where it does. Now, depending upon where you're cruising, the danger of you, if you will, is far reduced from a geographic perspective, because if you're in the Caribbean, you're only about an hour away from any other boat. So if you have a danger, another cruise ship's going to be there in a little bit because it's so darn crowded out of Fort Lauderdale and Miami. But if you're going across the Pacific, it doesn't matter how many boats are out there. There's a lot of space. And my experience has always been that you make of it what you will based on your attitude going in. And mine has always been cruise ships are where I unplug. I get fed. I get drinks. I get to sleep in. It's my recharge time. And I've never had that anxiety of if something goes wrong, but I have been on a cruise ship where a fire has broken out. I have been on a cruise ship where the toilet system starts backflowing, which is why I always carry an air freshener now when I travel. Because it may not be your room, but it's a closed system.
Yeah. No, and these are some of the invaluable lessons that it's great that y'all are providing, this resource, kind of a one-stop shop of lessons learned.
And then we're also trying to do something a little bit different, which is a lot of governments put out daily, security alerts, travel alerts, this, that, and the other. And they put it out at different levels, red hot, high level, or mundane, just be alert. And what I'm trying to do is pick 4 or 5 a day and highlight them to the audience Monday through Friday that we call our Securely Travel Brief. And it's very brief. It's a quick read, maybe 4 or 5 locales around the world where something is going on that if you're traveling to that area, you're going to want to be interested in.
Yeah, that's fantastic. And you certainly are one of the few people that have that broad expertise. So right after this commercial break, let's delve into that a little bit deeper. You're listening to Buzz Off with Lawyer Liz on America's Web Radio.
Affordable health insurance was the promise of Obamacare, but for many, the government mandate caused more problems than it solved. This is Dr. Elena George from Medicine on Call, and I want to tell you about a truly affordable alternative allowed under Obamacare, Liberty HealthShare. Liberty HealthShare bypasses doctor and hospital panels, giving you the freedom to choose. And with a maximum of $500 out of pocket per person and 100% coverage up to $1 million per year per occurrence, you can rest assured knowing you and your family are protected. Coverage starts as low as $107 per month and also includes dental, vision, pharmacy, and holistic care. Liberty HealthShare puts you back in charge of your health. Visit them online at libertyoncall.org. Again, for a true affordable alternative to Obamacare, visit libertyoncall.org or call toll-free 1-800-714-6993 today.
You're listening to America's Web Radio on the AmericasBroadcastNetwork.com. Thank you for listening.
Welcome back to Buzz Off with Lawyer Liz on America's Web Radio. I'm your host, Lawyer Liz. Find us each Wednesday from 2 to 3 Eastern in the afternoon on americaswebradio.com, or find the Lawyer Liz podcast on americaswebradio.com, as well as iTunes, Google Play, Stitcher, your favorite podcast streaming service. Chatting today with Christopher Burgess, and before the holidays, he gave us some tips on what to do and kind of some of the ways the Internet of Things and senior safety. Well, now he started a new venture, Securely Travel, that we were talking before the break. It's the personal and kind of device information security when you're traveling, be it for business or pleasure. And Christopher, I teased a little bit that you have certainly built up this wealth of knowledge that you're you and the partners on the website are sharing, you didn't come by it, I'd say, hard, the easy way. What are some of the things that sparked kind of the interest and said, "Ooh, I worked at, in your national security roles and different things like this. We need more of this."
It's actually an easier question than you might have thought you asked.
Oh dear.
So Securely Travel came out of the necessity that I saw in the market, because for those who are involved in national security work, meaning anybody with a security clearance held by any government, their government requires them to get a travel brief before they go on vacation or business travel to a foreign locale, and when they come back to report on that travel and who they met. It's a basic counterintelligence tool to make sure that people don't get in trouble, because you and I both know that what stays in Vegas goes up on YouTube. And
exactly.
And in a national,
sometimes as it's happening.
As it's happening, exactly. And in some instances, people with national security clearances in the past have found that when they're traveling, they let their hair down a little bit more than they would if they were at home under close supervision of family. And that's just human nature. I'm not condoning it. I'm just saying it happens. So we said, maybe we can help these people who are mandated to give travel briefings, give them some cannon fodder to use in these briefings. So not so much put the fear of God into folks, but to explain to them the realities. For example, hotel rooms. Everybody stays in a hotel room, and unless you've got a toddler, you probably don't want the ground floor. But if you do have the ground floor and you do have a sliding door, do you travel with one of those little locks that's got a thumb screw that keeps the door from opening to be jimmied, or don't you? I submit that I've got one of those in my backpack, because I don't know what room I'm going to be put in. And if I'm in the ground floor and there's a sliding door, I don't want it opened on me. So I'll just put one of those little jobbies in the rail there, and that door is not opening without making a lot of noise. Similarly, I'll put a door jam device in my bedroom door of the hotel, so that when that door opens, if I'm asleep, there might be a chain there that can easily be broken or manipulated, but there's also going to be a loud noise when that door hits that jam alarm that I paid $6.95 for. And I put there. So I can sleep knowing that if somebody comes in the room, they're going to wake me up. Now, what I do next, I don't know. But lots of folks think that their hotel rooms are secure. And the reality is it's semi-secure.
Well, I would say there are just news stories out about, the basic, I'd say the hack, but how all of those keys can be replicated. And if I recall correctly, that a lot of the issues have been addressed, but where there's one, there's usually 5 or 6 others that maybe just haven't been discovered. I mean, what do you do other than, jamming the door to keep your hotel room? And I mean, you've got a safe in the room. Sure, I'll go to dinner. I'll leave my laptop in the safe. Does that cut it?
Well, it depends. What are you protecting and who you're protecting it from? So if you leave your laptop in the safe, or your jewelry, or your passport, or your wallet, you are protecting yourself from the passerby, the cleaning crew that comes in, the maintenance guy, but you're not protecting yourself, for example, from a nation state who already has the hotel on there, helping them, and they're just waiting for the high sign that you've left your room, and now they're going to walk in. They've got the device to open up that safe, because no one has ever checked out of a hotel having forgotten the combination of the safe and left their $10,000 worth of jewelry in there. Believe me, that safe can be opened in 30 seconds with the right device. But that right device isn't something that is normally carried about. So I always view hotel rooms as semi-private environments. When I travel to China, for example, every single time I have been in China, and this is kind of funny, I get the mirror room. And what I mean by that is the last time I was in Shanghai, my room had 17 mirrors. And it was also next to the utility closet. So I just assumed that there was lots of video going on in my room, and they saw a fat guy go to bed, alone.
Were you tempted to ham it up, and like give almost like the towel dance,
I
just something
on that opportunity. But there was a time back in 1995, I was in a hotel room in a faraway land, and I noticed that my television had 3 wires leaving. It was one for the cable, one for the electric, and one for something else. And that something else, when I looked at it, weaved its way in. It was connected to the speaker of the television. Now, those who have a modicum of understanding of electronics know that speakers can also serve as microphones. And so I pulled really hard on that cable to see what happened in the wall. And in the room next to me, I heard all this equipment slam up against the wall.
Fantastic.
So I just exited the room, took my stuff, went down, checked out, and left. Because, clearly, whatever reason I was in the room, somebody else had more interest in why I was there. And so is this something that happens with regularity? Well, there was a board meeting held by Porsche in 2008, and somebody, and it was in a suite, and somebody planted a baby monitor underneath one of the sofas in this suite. A baby monitor. And the baby monitor, as you may know, has a radius of about 100 feet. And it was the perfect device, because when it was found, and it was, there's plausible reason. Somebody had a baby, and they left the monitor here while the baby was sleeping. They were enjoying themselves in the other part of the suite. Except when they went and looked at the records, nobody with a child had ever been in that room in a year. So there you have it.
So you're saying corporate espionage is alive
and well. It's never gone to sleep.
As we can tell from the baby monitor.
But, companies need to think about having that, to protect themselves from corporate espionage, having a travel security program. And that's one of the reasons security, we are pulling together in Securely Travel. The next phase is going to be focused on helping companies with that. And the program should include stuff like high risk and extreme risk countries that you absolutely have to, indoctrinate your personnel on demeanor and what may or may not happen there. You need to also have a briefing program instituted. And what we're hoping is that our information will be of use for those who are, have to do those briefings. And then you need to have an education program so that everyone understands that when you go to country X, be it on holiday or in business, and you are carrying your corporate laptop, you may be putting the company at risk.
No, absolutely. And talking today with Christopher Burgess, not only have you lived this, done this, but I mean, what are some of the other, what is the most shocking thing you have had to explain to someone? I mean, other than, hey, be aware, your devices have, the keys to the kingdom, so to speak. But what was some piece of advice you've either heard or given that you just want to do the face palm of, I can't believe we've just had to say this out loud?
There's a great app called TripIt. And TripIt is a great way to track your travel. And they have a function that you can, every time you put your trip in there, it posts on LinkedIn. or it posts on a different social network, where are you going? So, as you may be aware, I used to have my own company called Prevendra, and we did competitive intelligence. And so a company hired us to look at themselves from a competitive standpoint. And within like 2 days, I had identified their number one closer and where he was traveling and when he was traveling. And I was able to predict where he was going and who he was going to be meeting with in that given area, given their industry. And I kept feeding it into the system. And they kept coming back and said, how did you know we were going there? How did you know? And I said, well, if you're going to Bentonville, Arkansas, if you're in the aviation industry, you're going to Hartsfield Airport, or you're going to Chicago, then Seattle.
Exactly.
You might be talking to Boeing. I'm not sure, but there's an outside chance. And, so my point being is that was my face palm, where I showed this to them, and they looked at it and they go, well, isn't that a cool app? And I'm going, no, it is a cool app, but make it private for you.
Dude.
Make it useful for your accounting purposes. And do you understand that I don't know who's behind this app, but what if your competitor owns that app?
That's a very good, very salient point. Well, even in the world of drones, reminding everyone that, this is great. You're flying this easy-to-use drone, COTS, commercial off the shelf. Just go for it. It's so simple. Yet, do you understand who manufactures it, and that all of your data, all of this information that you're getting of your critical infrastructure is going right back to an actor or an agent who doesn't have your best interest at heart, be it intellectual property or otherwise.
Exactly. The crux of the issue is that we're now all using social networks. Rare is the person that's unplugged. And those social networks are the bugaboo for individuals oversharing and putting themselves at risk.
Well, I was going to say, speaking of individuals, we're going to jump to our last commercial break. When we get back, let's delve a little bit into that. And what are some guidelines you have for individuals as we're planning our trips? And you're listening to Buzz Off with Lawyer Liz on America's Web Radio.
This is Dr. George from Peachtree ENT Center. We've won patient care awards and have the highest patient recommendations because we believe in practicing medicine the old-fashioned way. Practicing good medicine is based in listening to the patient and making a care plan that is individual. The best medical care is given when there is a strong doctor-patient relationship built on mutual trust and respect. At Peachtree ENT Center, we believe in taking care of the whole patient because healing is more than writing a prescription. Whether you have problems hearing, have frequent throat or sinus infections, from the time you call our office and speak to a real person, you'll be treated as an individual and not as an ailment. During your visit, you will not be rushed, and all your questions will be answered. When possible, natural treatments will be recommended to fix the problem. If surgery is recommended, cost-effective, minimally invasive treatment for snoring, sleep apnea, or sinus problems will be offered because Peachtree ENT Center is where patient care counts.
Cook Immigration Partners is your passport through the immigration maze. Whether it's help with E-Verify in your business, or help in how to document a new employee under the new I-9 rules, or if you marry a foreign national, Cook Immigration Partners is your best choice for a legal advocate. Call us today at 866-286-6200. That's 866-286-6200, or visit us on the web at www.immigration.net.
The disease of addiction is a life-altering challenge, not just for the person suffering its effects, but also for the family and friends who support and love the one caught in its grasp. What should be the course of treatment? Who is the best person to render treatment? And what is the best place to go for the care that is needed? We know that you want answers to these and many more questions. Call 770-696-9862 and speak to a representative of the Atlanta Healing Center. They can tailor a program specifically designed to address the needs of the person suffering with an addiction, or give you guidance as to where that help may be found. Information is the key, and the trained staff at AHC is here to assist. If you wish, you can also get more information on the website located at www.atlantahealingcenter.com.
You're listening to America's Web Radio on the AmericasBroadcastNetwork.com. Thank you for listening.
And welcome back to Buzz Off with Lawyer Liz on America's Web Radio. I'm Lawyer Liz, talking today with Christopher Burgess. And Christopher, before the break, we were kind of getting into some of the oopsie moments. It doesn't surprise me with, what was it, TripIt, considering the running app that everybody was using, and that it unintentionally ended up mapping some very secure facilities because people would jog around outside. I mean, as I'm getting ready to go on summer vacation, etc., what should I do, or what are some of the things I should keep in mind that I may not be thinking about?
Well, the first thing you should do is plan on having fun, because who goes on vacation to have a shitty time? Excuse me, a crappy time.
Not me, Shitty, not me.
So if you're going abroad and you're a U.S. citizen, my recommendation is that you take a moment and register your itinerary with the U.S. Department of State and their Smart Traveler Enrollment Program. The process is a piece of cake, and it's on their website. You just put in your identifying information and your travel itinerary and your phone number that you can be contacted at, because if there's a natural disaster or a man-made disaster and you need to be evacuated or citizens need to be warned, they have a means to contact you. If they don't know you're in the country, they can't help you. All right? So that's the first thing I tell someone when they're going abroad. The second thing I tell somebody when they're going abroad is make sure that your credit card company both know that you're traveling to a given locale. So I'm blessed. I've got a daughter and son-in-law I can leave stuff with. But when I go abroad, if I lose my wallet, I know I can call them and they can shoot me the contents of my wallet back to me so I can get it all replaced. And
oh, that's fantastic, because you don't want to keep the picture on your phone, obviously.
Exactly.
Because,
or you could put it up in the cloud in encrypted format with your, with a password. Same thing for your passport. If you're traveling, make sure the information page that you carry a copy with you, but that you also leave a copy with somebody else. And why do I say carry a copy with you? Because oftentimes in foreign countries, you're going to be asked to surrender your passport when you check into a hotel. It may not come back for 12 hours. But if you have a copy and it doesn't come back, at least when you present yourself at the embassy, they can quickly issue you a replacement one. Similarly, money. Let your company know, if you're in charge of money, that you won't be issuing any requests from abroad.
You will not be sending the email that says, please, I've messed up this. Please, yeah. Because, I mean, that is a phishing scam that has nabbed some embarrassingly high-profile targets.
According to the FBI, it is the fastest growing scam because it is also the most lucrative, because folks don't think about it. And so my recommendation is, if you're traveling and you have your home business, make sure everybody in the home business knows that I'm on vacation. If I lose my phone and somebody contacts you, how are you going to know it's me? Put together some protocols so that you know that it's there. If you're on a long trip, you might consider also putting together what I like to say is daily check-ins. Because, if you're on a safari or if you're, hiking in the mountains, accidents happen. And so you can keep your family at ease. For example, when my wife and I were on safari in Africa, every day we checked in. And by checking in, it just, it gave us an opportunity to update them on what was going on, but also everyone had peace of mind that nothing untoward had happened to us in a faraway place where nobody would know you were missing because nobody's watching out for you. Same thing with your online presence. Understand that rare is the hotel system that is secure, and very